I'm Dr. Catherine Donnithorne, and I've been with Montgomery Eye Physicians for a year and a half. I am a comprehensive ophthalmologist, so that means I care for all kinds of eye conditions, from a patient needing glasses with a normal eye exam to all kinds of ocular pathology. I specifically specialize in cataract surgery. I also do eyelid procedures, glaucoma surgeries, and some medical retina procedures. There are all kinds of illnesses that affect the retina. The most common that we see is diabetes affecting the retina and macular degeneration. There are other conditions that can affect the retina, like vein occlusions or artery occlusions. The most common are diabetes and macular degeneration. The most important thing in diabetic retinopathy is that the patient is in direct communication with his or her primary care physician to keep the glucose under really good control. The patient also needs to have regular eye screenings with a dilated exam at least once a year. If the patient has diabetic retinopathy, then there are different treatments that we can offer for the patient to have improved vision. Diabetes affects the blood vessel walls, causing the blood vessel walls to become weaker and allowing blood to flow out of the blood vessel walls, fluid to flow out, and also exudates or deposits. These deposits are made of cholesterol and calcium deposits. And all of these things, the blood coming out of the blood vessel walls, fluid, as well as exudates, can cause decreased vision. There are different ways that we can treat diabetic retinopathy. The most important is having the glucose under excellent control. If the patient has swelling within the macula, then we can treat the swelling in two ways. If the swelling is far enough away from the center of vision, then we can treat that swelling with laser. That can reduce the swelling. Also, we can treat the swelling with an injection in the eye. The injection targets the swelling to help dry up that fluid to improve the vision. Macular degeneration affects the retina, and it affects the bottom layer of the retina principally, but it can also cause swelling within the retina. There's two different types of macular degeneration. The most common that we see is called dry macular degeneration. That means there's no swelling and no bleeding within the retinal layers. The other type is wet macular degeneration, and that is including swelling, which can be fluid or blood in the retina. Every patient with macular degeneration needs an eye exam with a dilated exam at least once a year, but most patients need an eye exam at least every 6 months. The patients that have dry macular degeneration can help prevent the dry macular degeneration from worsening and also prevent wet changes by taking eye vitamins. There are specific eye vitamins that we recommend for those patients to take to help prevent the macular degeneration from getting any worse. There are also vitamins that we can eat in our diet. Those vitamins are the vitamins that are really rich in the vegetables and vitamins that are good for our maculas. Those include spinach, kale, turnip greens, sweet potatoes, and carrots. Also, we encourage all patients to avoid cigarette smoke because cigarette smoking is associated with macular degeneration and worsening of the macular degeneration. We also ask patients to avoid direct sun exposure by wearing sunglasses. If a patient has wet macular degeneration, we can treat that wet macular degeneration with an eye injection. The injection dries up the fluid and helps improve the patient's vision. You can schedule an appointment with us by calling our office or scheduling your appointment online.